to 4 Directions of Wellness. I'm Roberta Diswood. Tubahan Ishlan Sisakadi Bashichin, Nakai Hanahi Dashanella. There's a lot to do to manage diabetes, from daily care you do yourself to lab tests and visits with your healthcare team. Living well with diabetes includes staying on schedule with self-checks, exams, and appointments throughout the year. To help us figure out this schedule and the importance of diabetes care is Colleen Barber. Hi Colleen, thanks for being here. Go and tell us about yourself.
Yat she Colleen Barber Yenishia. Todikoja Nashlo Ashin Bashichin, Tachine Dashanala do, Zistlane Dashichi. Hello, my name is Colleen Barber. I'm a registered nurse and a certified diabetes educator. I work in the Health Education Center for Wellness with the Diabetes Education team.
Well, thank you. So diabetes care includes lab tests, eye exams, dental exams, foot exams, and vaccines. Let's start with lab tests. What are the lab tests patients need?
Okay, a person with diabetes can have their urine test ordered by a provider. The test is called the microalbumin urine test. It checks for the protein in the urine and how the kidneys are working. High blood pressure, high cholesterol, and high blood sugar can cause the kidneys to stress out and lead to kidney disease. This urine test is updated once a year or as needed. The provider will go over these results with the patient. The blood test checks for blood fats, such as cholesterol and triglycerides, as well as thyroid, HIV screening, hepatitis C, kidney, and liver. The provider will update the results with the patient. These blood tests are done every year. Pharmacy will not renew medications if labs are not updated for over a year. So please make your appointment with your provider every 3 to 6 months so these blood and urine tests are up to date.
So there's a lot of tests that these patients are getting. I've heard of the A1C blood tests. How often should they be getting it?
For the A1C test, that is done every 3 to 6 months. This measures the average blood sugar for the past 3 months. The A1C test is used to confirm a pre-diabetes and diabetes diagnosis. A1C test is used to help adjust or start diabetes medications. Also, the A1C can help a patient work on their lifestyle changes, which are exercise and nutrition self-care behaviors.
Okay. So next we'll cover the exams that patients need, starting with the eyes. Why is it important to have your eyes checked if you have diabetes?
It is important to get the eye photo exam done every year. It is called JVN, Jocelyn Vision Network. This machine takes photos of the blood vessels inside the eye. Blood vessels can burst and lead to vision problems or even blindness if diabetes and blood pressure are not managed. This is called diabetes retinopathy. It is recommended to get yearly eye exams with eye dilations. At Northern Navajo Medical Center, this office is located in the Yucca area. There are signs posted that can help a patient find the JVN office.
Okay. And I know that dental exams are also important for people with diabetes. Why is that? And when should they be getting those dental exams?
Dental screening for diabetes is recommended every year. This is called the periodontal screening, which checks the gums and bone level. Bone loss can be caused by periodontal disease. It is important to brush and floss every day and get a yearly dental exam. High blood sugar can lead to gum infection or other teeth problems.
So we've covered our eyes and our teeth. Now let's move all the way down to our feet. I know that patients need to get their feet examined. So can you explain that?
People with diabetes should have their feet checked yearly. This is called the foot exam. It checks for sensation, blood flow, nerves, and skin or toenail conditions. Daily foot care and hygiene with proper footwear are all important in self-care. Poor blood flow to the feet is called diabetes neuropathy. This is caused by high blood sugar, high cholesterol, and high blood pressure.
So you talked about yearly coming in for the exam, but how about self-care that they're doing at home?
Okay, a person can check their feet daily, by looking under their feet, or if they can't see their feet underneath, they can have a family member check their feet, or they can use a mirror and check for any redness, swelling, or any calluses or bunions, or anything that is related to dry feet, like skin that is cracking, or odor could be from a fungal infection, and toenails that are long and they should be trimmed or cut. And if someone is not able to do that, they can see their provider and do a follow-up visit with them for that.
Okay, that's good to know. And last on our schedule is vaccines. Why is it important for people with diabetes to stay up to date with certain vaccines?
It is important to update all of the booster shots, which are vaccines. These include influenza, newly added COVID boosters, Pneumovax, Tdap, hepatitis B series, and Shingrix, to name a few. Booster shots will help the body fight infections such as pneumonia, flu, COVID, shingles, and hepatitis B. Patients can check with their healthcare provider at their next visit to see what vaccines are due.
Well, thank you, Colleen. This has been such important information and will help patients get back on track with their diabetes care so that they can live well with diabetes. This has been 4 Directions of Wellness. Hogornet.